I'm Nici Reece. I'm one of the clinical fellows based here at Pinderfields Hospital. So I work in medical education and I do locums in A&E and general medicine. So when students come to the ward, if they get there nice and early before the ward round, it's nice to have a chance to show them the department and show them the staff room, the toilets where they can leave their bags. And I find students like to know that they know the ward they're working in and feel welcomed. So the day in hospital on a normal ward is structured with a ward round in the morning, usually led by a consultant or a registrar, and then in the afternoon the juniors peel off to do the jobs that were set out on the ward round. So the ward round can be a really useful learning opportunity for students. I like to try and keep them involved on the ward round by letting them know a background about each of the patients, and if students aren't getting this kind of feedback, I think it's useful for them to ask questions about what's gone on with the patient in the past. Often the rest of the team know everything that's happened with that patient, so just little updates for the students to keep them involved is really useful. Other things that students can do are ask to write in the notes, and that's a good way to keep engaged, and ask to see x-rays and test results and try and interpret them for themselves to practice their investigation interpretation skills. Sometimes students come onto our wards and they might think that there's nothing to do. If the doctor they're shadowing is documenting a lot or on the phone, obviously they can't really get involved in that process. And sometimes students feel that they might be better off going to the library or having a read, but actually using that time on the ward is really important, and there are other health professionals that they can go and speak to. So I would say it's worth going to speak to some of the nurses. If the nurses are giving IV fluids or making up IV antibiotics, these are student competencies, so it's useful for the students to go follow the nurses. They might watch the nurses do it and ask them to explain what they're doing, or even perhaps to have a go doing it themselves, because these are skills that you don't use often as a doctor, but it's useful to know how to do it if the department's really busy or if somebody's really poorly. And in the same way, I think it's one of the third year competencies of knowing how to do observations on patients. And if you can follow a healthcare professional and go around and do the observations with them, getting comfortable taking blood pressures, taking the respiratory rate, these are all useful skills that the students can do at any time on the ward, and they don't just need to wait for the doctor to tell them to do that. In order to find jobs that are appropriate for students, you can check the Students' Expectation Guide, which outlines what first up to fifth year students should be able to do. I like to check when students come on the ward what they feel comfortable with, what they feel practiced at. So if, for example, a first year student will have a basic understanding of science and not really much clinical knowledge at all, so they'll probably be happy to have things talked through with them and see things. As you move up to second years, they'll probably be wanting to practice histories and examinations, and third year students should be starting to do taking bloods and cannulas and things like that. But depending on the placement of the student, there will be quite a big range in what people are comfortable doing. So I like to check with the students, and often if a student is the first time we're working together, I'll go with them to a patient and watch them do a cannula or take some bloods, just so I feel that I'm happy with them taking that, doing that skill, and so and I think it's safer for the patient. And if they've proved that they can do it in a safe way, then from then on I might let them go on their own to do those skills. And that would help me lighten my job load, and then also they get a chance to have a bit of time with the patient, a bit of autonomy talking things through. When I work in A&E and students come with me, sometimes different doctors work in different ways. I like to take students with me when I see patients, and I like to get the student as much as possible to take the history and examine the patient, and then I can sit in the corner and write everything down. I find this is good for a number of reasons. Firstly, the students like to feel that they're being observed. I can give them critical feedback and really try and hone those skills that they'll need to develop as they go through medical school and onto being a doctor themselves. I also find that it's useful to write down as we're going through. This saves a bit of time, and it means that the patient only has to tell their story once. The patients like it, they get seen quicker, and we can make a plan sooner, and sort of all of us benefit really. So that's the main way I like to do things when we're in A&E. as a student, when you're coming onto the ward, the most important thing you can do is be there on time and be enthusiastic. Doctors really respond to students who want to get involved and learn as much as possible. I like to make sure that I give the students a chance to say what they want to learn. So don't be afraid to say what it is you want to get out of the placement. And most doctors will be really happy to try and make that happen. And just ask questions and be helpful where possible, and you'll get lots from it.